Hi, you guys. I wanted to go over the planes of movement a little bit more and movement of the body because it can be confusing. So in the sagittal plane, movement is always flexion and extension. And so flexion and extension occurs along this sagittal plane that would divide my body into left and right halves. So we have flexion of the elbow, we have flexion of the shoulder, we have flexion of the neck and of the trunk. You can't see my hips, but flexion of the hip and the knee and the foot as well. Specifically with the foot, you have plantar flexion, which is pointing your toes down, and dorsiflexion, which is bringing your toes up. The frontal plane divides my body into front side and back side. The movements in the frontal plane are abduction and adduction. We have elevation and depression of the scapula. And then with your foot, this is kind of a funky one. It's inversion and eversion of your foot. So I can post a different video for that one, but inversion and eversion of your foot. And then in the transverse plane, movement is always rotation. So we have rotation at the shoulder. You could do internal rotation, external rotation. It also looks like this. Internal rotation, external rotation. You have that rotation at your hip as well, external and internal rotation. We have rotation at the trunk or the spine and rotation at the neck as well. The tricky one, we have pronation and supination. So pronation is hand down, supination is hand up. Pronation and supination, that's rotation of your forearm. And then the tricky one is the horizontal abduction and adduction. So in order to get into a position for horizontal abduction of your shoulder and then adduction, adding it back to the midline. So that horizontal, since your shoulder is already in this flexed position, you bring it out, that's abduction, horizontal abduction, horizontal adduction. That movement actually occurs in the transverse plane as well because of the starting position. I think a lot of confusion comes when we talk about, a lot of people seem to think we have rotation at the knee and at the elbow, but if we remember, the knee and the elbow are both hinge joints. So the movement is really flexion and extension at both the elbow and the knee. When you start to see things like, you're turning a knob or unlocking a door with a key, we can see that there's some confusion with this elbow rotation. The elbow is not actually rotating. It's the shoulder coming into external rotation or the forearm going into pronation and supination. So when we're talking about any kind of what looks like rotation at the elbow only does flexion and extension. The rotation is coming from pronation, supination, or from shoulder also. So I just want to make sure that was a quick synopsis of movement in these planes of motion. Make sure you ask questions if you have any concerns.